Hi everyone, Dr. April Calderon with Euphoria Health. I wanted to give a little update into antibody testing and just testing in general for coronavirus and talk about the different types and the issues that are surrounding the antibody test. So let's talk about the first type of test, which is a PCR test. And this tests for active infection, an infection that someone is currently symptomatic with. This is done with a swab through the nose to the back, and again is done in people who are symptomatic. So the next test we have is our test that many people are excited about, and I'll group them and say they're the antibody test. And this tests for antibodies that your body produces as an immune response to the virus. There are many different types of these tests, but we'll focus on the IgG, or the long-term immune response antibody test. So what is an antibody? An antibody is produced by the body in response to an infection and can signal immunity to that infection, meaning it can signal that there is protection against the infection. So when we talk about the antibody testing, we also have to talk about the different types of antibody testing. The first type is a POC test, which is a finger prick. And then the other type of test is a blood test, or a serum IgG. The first issue we'll talk about is with the POC test, and it's with the test's specificity. So when we have a test, we want to make sure that that test is giving us information about a specific virus. The issue is that many of these tests aren't specific enough for COVID-19, which means that if you have the test, it could potentially cross-react with other virus or other coronavirus subtypes. And so if it's positive, it can give you a false sense of security that you are protected from COVID-19, when in reality, you may be protected from other coronaviruses, not COVID-19. The next issue arises from the accuracy of the test, and this is for all the IgG antibody tests. When we talk about accuracy, we also have to talk about the prevalence of the disease in the community. And so the prevalence, if we describe it as how widespread the disease is in the community, we may assume that it's 1% in the community. Now, we're not talking about a specific community, we're just using some numbers. So 1% prevalence means 1 out of every 100 people in that community have the infection. So if we base some numbers off of 1% prevalence and then have a test that's 95 to 97% specific, which is pretty good, not great, but we're not going to reach 100% specific tests. But say we have these assumptions for the numbers, then what we're going to get is a 50% accuracy, meaning 50% of the time it's going to be a true positive, and 50% of the time it's going to be a false positive result. And I know for myself, my family, my patients, I would not take a chance or recommend them going back to their normal daily routines with a 50% chance that they could be not protected and could be further exposed to disease. So the next issue we have is immunity. We don't know what immunity to coronavirus looks like. Could that mean that you're immune and protected for many years, for your lifetime, for a couple of months? And what level of immunity do we need to reach to get that 100% protection? We don't have these answers yet. And so in general, the antibody testing is not providing us with the answer that we want, which is, yes, you are safe to go out and get involved with your community, it's safe to allow everyone to be outside without masks, to go back to your normal daily routines. I know this is a hard topic. These are just some generals. If you are interested in specific information, if you have any questions, please leave them in the comments. You can always get in contact with us through calling Euphoria Health. Again, my name is Dr. April Calderon. I hope you have a great day.